Hello, I'm glad you could join us today. Welcome to the webinar Building a Model of Collaboration and Engagement, the TPAS model. My name is Angie Fiedler-Sutton, and I use the pronouns she, her. I'm with the National Behavioral Health Association Providers. The National Behavioral Health Association Providers, otherwise known as NBHAP, is a national trade membership association that provides education and advocacy for behavioral health care providers and related entities. We are the leading and unifying voice of addiction-focused treatment programs. We provide membership benefits such as networking and access to compliance information, educational opportunities such as this webinar and our Certificate in Addiction Treatment Marketing, the CATM, and advocacy efforts to keep those in the industry aware of new laws and regulations that may be coming that will affect them. Working in the behavioral health industry or managing an organization in the industry can be incredibly complex and filled with ever-changing information. NBHAP gives you resources to stay on top of the rules and regulations for your organizations to stay compliant. For more information about NBHAP, you can visit our website at www.nbhap.org. And now it's my pleasure to introduce our presenters today. Gina Thorne is the Executive Director of TPAS and a respected leader in the behavioral health sector with over 30 years of experience. She empowers organizations nationwide to develop and sustain impactful alumni programs. Her dedication to enhancing recovery communities has helped countless professionals build strong networks that foster long-term success for individuals in recovery. Gina's expertise and passion for alumni engagement have positioned her as a key figure in the field, guiding initiatives that strengthen community connections and support ongoing recovery efforts. She is going to be on an upcoming episode of our podcast, Destination Change, which will be released next week. Gina, I will hand it over to you to introduce your coworker, and with that, I'll hand it over to you two.
Thank you, Angie. It's really a pleasure to be here, and I'm really excited to be doing this webinar with Casey Hyatt, our TPAS co-chair. We're going to have a chance to chat with you all a little bit more about Casey's background and get familiar with him in a little bit. I want to thank NBHAP for giving us this opportunity to talk about the power of alumni engagement, and specifically around the TPAS model, which we believe is a disruptor in the field of behavioral health as it relates to what we're currently seeing in our landscape. And so with that, I'm going to go ahead and share my screen so that I can jump right into our presentation. Let's see if I can do this the right way. Okay, so let me see if I can do it this way. Yep, I guess this is the best I'm going to be able to do. Can you see that okay, Casey?
I can see it.
Okay, perfect. Great.
Sorry, I lost my tools.
That's okay. Great. So, so today we're going to be talking about building a model of collaboration and engagement. And this concept of collaboration is something that's incredibly powerful in our community of behavioral health now more than ever, as we're starting industry around consolidation. We know that treatment facilities are an absolute necessity. We know behavioral health programs, and when I speak about behavioral health, I'm putting that under the umbrella of everything that involves treatment, substance use disorder, mental health, eating disorders, anything that would fall under the behavioral health umbrella is what we as an organization really work with. And so when we talk about the nuanced nature of what's happening in our industry today around this concept of scarcity, we're going to be using our model of TPAS as a alternative to that concept. And so, so today's objectives, we're going to learn strategies that will help us sustain productive conversations and collaboration with people in our business, gain practical expertise around the Peter Block conversation, as well as open space technology. And we also would like to empower our attendees today to really look at your existing organizations and learn more about how your alumni programs really can be a vehicle for engagement for your alumni in long-term recovery or wellness, as well as how they can be an added benefit from a business model standpoint for census. So I'm going to ask Casey to share a little bit more about who he is. We're going to get into more of a Q&A conversation later today about TPAS to what we're talking about today. But Casey and I have had the opportunity to get to know each other and work together over the last year or so as the co-chair for the TPAS board of directors. But bigger than that, he has an extensive background in the world of recovery, working with Cumberland Heights. He is the alumni director for, excuse me, for Cumberland Heights. And while I take a sip of water, I'll let Casey tell you a little bit more about who he is.
Made me want to take a sip of water. So that's an interesting one. So you can read, and that's a very nice way to introduce me. But I think ultimately I'm just somebody who came into working in the recovery field as a peer advocate very early on in 2010, I think was probably my first opportunity to get an opportunity to work in direct care. And that kind of started from a place of just being guided by the heart. And I had started to go to school for social work, and it was the place that I most wanted to be. And when I say the place, I worked at a small residential facility that was primarily community corrections. And it just kind of grew from there. I moved around the country a little bit, ended up in Nashville, Tennessee, and worked with a place called The Ranch, which at that time was owned by Elements Behavioral Health, and learned a lot about experiential programming and really, really leaned in to getting my license as a clinician. And for many years after that, I focused really, really directly on building a peer resourced department within my organization, which was at that time Cumberland Heights Foundation, which is a large nonprofit here in Nashville, and spent a ton of my time really kind of building out a program that could double as peer involvement post-discharge. So follow-up calls, events, interactions, get-togethers, and kind of the traditional alumni programming, which I know we're going to talk a little bit about once Gina and I talk. But as far as who I am, I feel like I'm somebody who has been ultimately guided into the space that we're talking about today in a very intuitive way. And so I feel like I'm naturally here, and I haven't had to fight to be here, and I haven't had to change much about myself other than letting go some of the expectations that I had about what my career was going to look like, and just allowing my career to develop from the place of the heart. So
Thanks, Casey. And I really appreciate that concept of like, it's a natural progression for you to be here and in this field. I think a lot of folks, when you ask them about how do they get into the world of behavioral health, they often say that it chose them versus go the other way around. And that's exactly how I feel, is that I didn't outwardly go and pursue a career working in behavioral health, but it has served me personally in a very powerful way. And like you said, there was no friction in that process. So I appreciate you mentioning that. So for the purposes of today, I want to talk about this idea of scarcity versus sufficiency. I recently read a book by a woman named Lynn Twist, who focused on this concept of the soul of money. And it really resonated with me because a big part of what she talked about is that we currently exist in a world where we live in this framework of scarcity. And in her hypothesis is that actually scarcity is a lie. Now more than ever in our culture, we actually have more than enough resources to address some of the bigger deficits that we have in the world, including things like hunger. I'm going to bring that back to the world of what we do here in behavioral health to say that we have more than enough resources, and probably could use more, a little bit more resources around addressing the needs of people who need help with mental health and SUD issues. And I think what we've adopted in our culture is this mentality of scarcity. And that really is a you or me mentality. It's really looking at it as either you or I are going to get the services that we need, or you or I are going to get the client that we need in treatment. And it does create an incubator of some very negative competition and issues that come up when you go into a mindset of scarcity versus this idea of sufficiency, which is you and me. How do we work together? How do you and I work together to make sure that we're addressing the issues that are facing our communities today around mental health and SUD. And so I would argue that we are in a space of sufficiency in our field. In fact, we know that there are 30,000 treatment centers in the country, that there's needs that are greatly needed for folks. But sadly, I think what we find in our industry is that there's a great deal of fear that we're stealing clients from each other or taking things away from each other. And what we need to start adopting is this mindset of sufficiency, to know that that treatment is available, good treatment is available, and that we shouldn't have to approach it with a mindset of never having enough. And so when you think about that model of scarcity, some of the terms that come up, or some of the terms that I actually hear quite a bit in our field around never being enough, emptiness, fear, mistrust, envy and greed, competition. I hear the word competition a lot in our field. A lot of judgment of other programs, entitlement, the nature of like what's mine is mine and what's yours is yours, and we're not going to share our secret sauce with each other, really does kind of cultivate this barrier for many of our clients being able to access treatment. Whereas if we went into a mindset with this concept of sufficiency, you and I working together, we actually see more terms that focus on gratitude and fulfillment, trust, respect, contribution, compassion, partnership, resiliency, where we're actually looking at the bigger picture of how can we help individuals get access to services in more of a collaborative approach versus a competitive approach. And so setting the tone for what TPAS represents as an organization is that we really believe in this concept of collaboration. We believe in this concept of sufficiency, that we do work hand in hand together with other providers, with other alumni professionals, where we share resources, where we believe in reciprocity, because we believe in our world, resources are not only enough, they're infinite, and that we need to be able to collaborate in this mindset of sufficiency in order to help individuals stay sober, stay well, and access the resources that they need. And so as we lean into the nature of alumni engagement, much of what we talk about over the next few minutes is really going to be about the evolution of alumni services in behavioral health over the last 15 or 20, sometimes even 30 years. And more specifically over the last 15 or 16 years when TPAS launched, where it became more of a center stage department and resource for the behavioral health community. Back in the early days, alumni services were really seen as an ancillary service to treatment. It wasn't necessarily front and center. It wasn't a main department. It was really sort of an altruistic, feel-good department where the treatment facilities were doing right by clients by offering them an opportunity to connect after they left treatment. But really, treatment as an organization was designed to be episodic in focus. It was an acute care model. People came in, they got stabilized, they were able to receive basic services to help them get to the next level of care. And then they were discharged and moved either to a partial hospitalization or IOP program, and in some cases moved into working in the community within the communities of the rooms in 12-step. But treatment as an organization or as sort of an entity didn't really look at alumni services as a value proposition the way they are today. And so in 2018, TPAS wanted to learn more about how is alumni making a difference in the field of behavioral health and specifically in treatment. And we conducted a white paper study with those treatment facilities that have successfully grown and built alumni programs. And we had some very important information that kind of leaned into this idea of alumni really has a value add in our field. The first thing we learned, of course, is that when you're building a very strong alumni program, you're increasing engagement with people who are going to build recovery community. In many cases, when you talk to some of our alumni, they're saying that their alumni programs that they're affiliated with are their ways of staying sober. Some may not go into 12-step meetings and go into the rooms. They may be more inclined to be connected within their recovery communities that are built by their alumni professionals from the treatment centers they graduated from. And so knowing that we've seen this sort of increase in engagement when you're building these strong kind of sticky programs, really does lean into people are choosing to stay sober. They're choosing to connect and build relationships with others that have gone through a program similar to theirs. The other two variables that really were sort of a wake-up call for our leaders in the field was the fact that they were finding that those that really made the investment in their alumni programs saw that up to 50% of their referrals came from alumni. And that was a staggering number for a lot of our leaders who were looking at how do we be a resource for our alumni? How are we keeping our lights on? How are we addressing referral engagement? And what they learned was that a lot of the alumni folks that were leaving treatment were the natural brand ambassadors for their brand, for their program. And they were out talking to people about their success stories, the value of what they learned from treatment, what they got from their program. And in turn, they were making those recommendations for friends, families, and folks that they knew to come back to their facility. And so knowing that they were seeing such a huge increase, we dug a little deeper and learned that when you look at the cost per admission for an alumni referral versus some of our other tactics that we use to get the phones to ring, so marketing tactics, Google Analytics, PPC campaigns, outreach referrals, that kind of thing. What we found comparatively was back in 2018, and these numbers have increased a bit, the cost per admission for an alumni referral averaged between $700 and $1,100 per admission versus what we were seeing with some of our more traditional marketing tactics. Sometimes it was starting as low as $3,500 and now today up to $10,000 per admit for some of these marketing referrals coming in. So when you look at that delta difference between your alumni referrals and your marketing referrals, it became a no-brainer for a lot of our executive leaders to say, we really need to do a bigger job of investing in our alumni programs. And that involved making sure that we were hiring and retaining and training these alumni coordinators that were coming into these positions. Now, the role of the alumni coordinator, as I mentioned earlier, was much more about programmatic, sober fun activities, support groups. But the evolution of an alumni professional today has changed drastically over the last 10 or 15 years. And we're going to talk a little bit about that. The third value proposition for an alumni program is the concept of what we hear now more and more about value-based care. Value-based care is in conversations with everyone, especially if you're in the commercial insurance world, where many of our payers are asking for outcome data. They want to know, does your program work? They also want to make sure that the data that's being collected is being communicated to the consumer. Are our family members and clients aware of how your program is in fact making a difference? And so the concept of value-based care is not going away. That accountability piece of treatment continues to grow exponentially. And what often we find is that unless you're a treatment center that has a large, robust research institution, more than often, alumni professionals are the ones carrying the responsibility of collecting that data. And so where in the past, it was usually living within the space of case management or clients were being asked information right before discharge, now that alumni professionals are more engaged, talking to alumni after they leave treatment, we're starting to see that they are the gatekeepers of this data. They are being asked to collect very specific information on client success, on how they're utilizing their post-treatment resources to help them stay sober. And then that information is being collected and then leveled up to leadership, which oftentimes can be used to negotiate higher reimbursement rates for commercial payers, might also be used for marketing. And then, of course, just being able to use the data to pivot when things might not be going well, to helping to elevate, their clinical program, identify new modalities that might be beneficial for clients. And so between the creating robust recovery communities, the revenue generating opportunity for alumni, and the fact that we're now data gatherers, it really has put us center stage as a key resource for treatment facilities in the behavioral health space, which is great. But it also requires that we have to continue following through on this model of sufficiency, and that we're not here to, claim that this alumni is us, because let's be honest, many of our clients that we have in treatment are alumni of probably 4 or 5 different treatment programs. And so to claim that person is just your alumni would be kind of looking within the model of scarcity versus saying, how do we all work collectively to help support that person staying sober and well in the long term? For many of you, you're probably familiar with William White. He is the the early adopter around the evolution of treatment. He wrote the book Slaying the Dragon. He's also deeply connected into the world of recovery support. And he put a stamp on the power of alumni services in 2013 in a white paper that he wrote, where he quotes saying alumni services do in fact serve as a vehicle for post-treatment addiction recovery support, and that their role is equally as valuable as all of the other areas within the treatment space. Now, I want to clarify that alumni services is not treatment. We work really hard to educate our alumni professionals and our communities that our role is not to be a clinician. Our role is to remove the roadblocks for clients after they leave treatment that might get in the way of their early recovery success. And so we work really hard to differentiate that position and educate both our internal constituents, which are often our staff and our client and our leaders, about the role of an alumni professional, so that they're not stepping into a clinical role, which is not the nature of this position. So our alumni professionals are typically individuals who are either in recovery themselves or have worked in the field and have an affiliation for working with people in recovery. Their primary role is to help keep alumni engaged and sticky to recovery support. They also function as connectors and provide information and referral for many of our clients after they leave. They can work closely with clinical teams to assist with AMA and ACA blocks. They also work as a resource for case managers. Some of them actually wear multiple hats. Many of them are case managers themselves. But their focus is really looking at how to identify the right recovery support services for our case managers so that they're putting a good discharge plan in place for clients when they leave. As I mentioned earlier, they have adopted more of a data collector mindset. So they're doing a lot more work with alumni and data collection. The thing that they're most known for is working as a recovery, sober, fun, educational facilitator. Many of them will plan sober fun events to really help educate and teach people in early recovery that you can have fun in sobriety. They many times use these sober fun and opportunities as incubators to really help clients utilize the skills that they've learned in treatment to be successful. And if they slip or if they fall short in some way, that they can have a system that's in place to help them catch them, which is a big part of why these alumni recovery communities are so powerful. Many of them are trained as peer recovery coaches, and I believe are continuing to move in that direction more and more as doing one-on-one coaching sessions with a lot of their alumni. And as I mentioned before, they are people in recovery. We really stress that our alumni professionals are not 12-step sponsors. They're not designed to, some of them are in other areas of their life, but the nature of an alumni coordinator that works for a behavioral health organization really is not set to be a 12-step sponsor. They're not therapists or counselors. They're not nurses or physicians. They don't diagnose or treat. They cannot provide any kind of medical advice. Really, their focus, as I mentioned earlier, is to take a look at what's going to happen in the future that might be a barrier that could prevent somebody from being successful in their early days of recovery. And so we work really closely. In fact, TPAS as an organization is in the process of building out a competency-based curriculum that will help alumni professionals feel more empowered around the tactical aspects of their job, so that when they are facilitating groups, they're not moving into a clinical space talking about things that they may not know much about or feel like they're, I use the term, over their skis and understanding what might need to happen if a client starts to decompensate. So our big part of what we do is we try to be very focused on the future and less about the past. And so who is TPAS as an organization? We are a nonprofit. We actually started in 2010. Our focus is we're a membership organization that works with behavioral health organizations. Our focus is to help and support organizations build strong alumni and recovery communities. we have two types of avatars. We have a macro avatar, which is the behavioral health organization. And then what I call the micro avatar is the alumni professional themselves that's doing the direct service work. So much of our membership benefits are really geared towards the alumni professional to really help support them in their success in building out alumni programming. Now, moving into this concept of TPAS as an organization, working with alumni, addressing this issue that we have in our industry around scarcity, how does that all play a part? We're going to talk now about the nature of how TPAS as an organization, when it started in 2010, really wanted to strip away this idea of scarcity and move into a place of abundance by really looking at how do we build strong community and connection. And a big way that we wanted to look at that is through how currently in our world, we're deeply disconnected. And if you look at what we see right now in our modern world, things like remote work and the gig economy has really isolated us a lot. When you look at social media and digital communication, while there's a lot of power behind that particular resource, it also has eliminated the possibility of connection. We're finding that people are less inclined to meet and have conversations. Even having conversations with people in grocery stores where food is now being delivered at your home, or buying and purchasing products in stores where now things can be delivered, on the fly, has really limited our ability for communication, for connection, and building strong connection and really creating a sense of belonging. And so over the last 15 years, TPAS as an organization has taken this concept of how do we help create the spirit of abundance with connection to build a model that's going to help bring people together. And so what we've done is we've introduced a new model that Casey's going to share with you now that really focuses on how we do that and what that power can look like for organizations moving forward. So Casey, I'll let you take it from here.
Thanks, Gina. Hello, everyone. I'm sure you're all saying hello back. So my very first experience with TPAS as an organization was at a collaborative, and I think it's similar for a lot of our new members in that maybe they're new in the job or they've just kind of been steadily moving through, and so many of our resources are kind of presented at our collaboratives, and these are in person and virtual. So I kind of like how this is broken down. I think the culture of sufficiency really kind of speaks to the fact that once we're all in the same room, so to speak, whether that's virtual or in person, everybody in that room has all of the resources that every single person needs. And we just really need to find a way to consolidate those things in practical ways so that everybody can leave with all of those tools, right? And I don't know about you, and I don't know everyone's background, but personally, I learn by teaching, and so much of what goes on at our collaboratives feels that way, right? I've been through this particular situation. This was my experience. This is what we did, or this is the insight that I have from another career, or this is what I learned in a different role, or whatever the case may be. And we kind of we're the collaboratives are like a solvent for that information, right? And so the collaboration, and I think what the next few slides are talking about is the way kind of that we scientifically walk our way through that so that we have a structure to it and people can kind of put expectations on it. And it's interesting because you've got people who maybe all they've ever done in this space is experience it, right? Like they're prior recipients or customers or patients or clients or whatever you might call them. And they've experienced this process from the other side all the way through to their high level professionals. And so everybody kind of comes with different expectations, and some people expect kind of a conference style gathering, and that's really not what we do or how we do it. And sometimes people are a little caught off guard by that, which is great. I love people to be caught off guard. It typically puts people in a better situation to learn, to be honest with you. And so that abundance of support that I kind of hinted at is definitely one of those things that people can take away from the collaborative. And I see more people continuing conversations and carrying over group texts and using our app and using our our continuum basically to continue the conversations that they started at the collaborative than I ever have at a conference, right? I get a lot of cards at conferences. I may have like key touch points with certain organizations or institutions, but the truth is that the collaborative does so much more deep, meaningful nuance than that ever has. So yeah, this is a cool one. I like how Samsha broke this down. Everything from Samsha isn't always simple, but we talk about, we use the term recovery, I think, more broadly than we ever have before, and I'm really grateful that it is kind of become expansive. Obviously, health and wellness is something that's always applied to being able to feel that sense of belonging, home, purpose. This is my place in this world or in this space, and our pitch, which our big move is community and the power of that. And I think Gina spoke to it, one angle of it, which is we're not a sponsor. We're not trying to create this this bonded relationship that is strategically warranted and all this, but it's more of like if I can give you this community and you don't need me anymore, then I've done my job. And ultimately that's kind of what we're getting at, and that's what we're working toward. So we use the same 10 guiding principles, and just to kind of lean in here on the TPAS model specifically, and what comes to the light from this. Peer support's huge, right? And my experience working in treatment and being a recipient of IOP and residential treatment modalities in my early life. It's a better way to call it, isn't it? In my early life, early part of my life. I'm going to pretend I got a couple Snickers out of that. Let's see here. Peer support is only now, it feels like, and it's probably been this way for maybe 10 years, like a viable term to actually use to talk about a treatment team or a treatment model or a modality in general. And it's been so wishy-washy for so long, but now finally it's part of the vernacular and something we support, and not only like coalesce with, but we create a strategic angle with. And so thank goodness that's kind of where we've ended up. The relational component, I think, is really interesting because that really speaks to the way that we foster the relationships within the organization, and not so much how we foster the moves that we're trying to make with our recipients. But ultimately, if people can't identify with me and my goals, not to be crude, but and I know this is being recorded, but like one of the first things I want people to know about me is that I give a crap. You know what I mean? I really care about you, and I want to see you do well. And whatever that looks like for you, I'm willing to match your energy and show up in ways that maybe nobody else on this team can, because that's the beauty of being an alumni coordinator, right? Is being able to follow up for years at a time. And the culture around that, and this is kind of that big battle that Gina is alluding to between scarcity and sufficiency, because one of the most beautiful things that I realized was happening when I first started going to collaboratives was we have chapter groups, right? So we're talking about, I can use Gina's area in Colorado as kind of a really good example of a region, right? A smaller region, because we're a national organization. So we've got this small region. I'm going to make up a word and say 120 miles circumference around Denver, right? Well, there's a menagerie of treatment centers. And when I say treatment centers, I'm talking about every single ism and every single neuroses you can think of, residential, non-residential, so on and so forth, all down the line. And more of those organizations have decided to couple up and be more invitational with what they do, as opposed to this person's doing these things over here and this person's doing these things over here. And the magnitude and the power that's created, and the shared resources have just created kind of a nonstop machine. And so you have these smaller collaboratives that are taking place on a local scale, and that culture is personified, infinitum. And so anyway, I think that's all I want to say, because I think I have a time limit with Gina that I had already reached when I got these slides.
You're good. You're good, Casey.
So about the science and about the procedure, and I'll kind of glance over this honestly, Gina, if that's okay with you. But the way we use Peter Block and the conversations that we have throughout the collaborative is really like it's, I guess, invitational is the best way to put it, but it sets a baseline for the intimacy that we're trying to use with each other. And so we have these 6 conversations during every collaborative, whether it's in person or not. And so the invitation obviously is one thing. What are you here for? How are you going to be here? The commitment, what am I willing to stand on while I'm here? The possibility, what am I going to allow myself to believe is possible through this process? What type of things am I able to take ownership of moving forward? What are my no's looking like versus my yeses? So many of us soften our yeses so much that our no's aren't sharp anymore, or vice versa. And I think what inevitably happens is we end up being part of the current that is most strong. And back to the scarcity versus sufficiency, we become a cog in the machine as opposed to a trigger point for the change. And so I think that's what a lot of the dissent conversations end up inspiring for people who are going back to their organization with a new mission and a new possibility. And then gifts obviously is a nice way we tend to close out each collaborative, because honestly, it's a very bonding experience for so many. This is kind of like our bottom lines as we walk through it. But it's nice to kind of set expectations for how we're going to have these conversations and what that looks like for each other. And here's an example. So possibility, everybody's favorite, right? People definitely want to look at themselves in a new light. And so that's how we kind of want to create that for them. But when we're having these conversations, these are the super intimate, often people who've only known each other for a couple of hours, conversations that we're having. So what's the crossroads where you find yourself at this stage of your life or work, or the purpose of our convening? What declaration of possibility can you make that has the power to transform? Working in triads, which is how we do this, and I should have mentioned that more specifically, but what you find is it pulls away from the homogenous experience of being a part of something like this and puts people in the driver's seat of their expectations. And so it's been a really cool process. And I've done many of these, and I never fail to be surprised. And obviously, we want to see people connect, build strong, lasting relationships, create a safe space, obviously, and get an opportunity to get real and build trust. These people are gatherers. We are the type of folks who are constantly on the move to help create connection. And we don't always get that feedback from others. We don't always get to have that experience. And so what you see is a lot of people who are thirsty. Like, the reason they're in this position is because they're so hungry for this real life experience. And they're finally given the opportunity to lean into that. And, the foundation of collaboration is often something we see get brought into their, milieu, whatever that might be, walking out of a TPAS collaborative, especially. But, it slowly has, what I've seen for long-term members is it really has changed the identity, not only of their alumni program, but portions of their treatment team and community, and, just the general mentality around what's possible for newly sober and newly well individuals going back to their communities.
Thanks, Casey, for providing an overview, particularly around the conversations that we do. And I think that, the concept of building those 6 conversations using the Peter Block model literally could be applied in any environment. It doesn't have to be just within the world of alumni engagement. I've actually introduced this concept to people in the space of outreach, leadership. And so listening today, if this is something that you think could be an interesting opportunity for you as you're running your strategic planning meetings or your annual meetings to operationalize some of this, you'll find that many of the people that you work with will really get so much out of getting out of their head and more into building connection in a more real way that maybe they don't always get a chance to do. So the part one of our TPAS model of, building abundance and sufficiency and collaboration was built around the Peter Block questions. The second is this concept called open space technology that was started by Harrison Owen. If you're not familiar with this concept, it's fascinating because it isn't even technology related. The concept is really about bringing people together with shared ideas to let them be teachers and learners in solving a problem. When this concept first came up, it started in communities where there was macro level issues that needed to be addressed around crime or hunger or homelessness. And what's believed within Harrison Owen's model is that we all have the solution. We know what the solution is. We just need to come together to figure it out collectively. And so the nature of open space technology as it's applied to TPAS is that we don't provide an agenda for people when they come to the collaboratives. In fact, they get quite frustrated with me when they call and say, can you send me the agenda? I need to give it to my leadership so I can get permission to come. And my response is, I really can't. But I can give you the start date and the end date. But I will tell you that when you leave a collaborative, you will have a playbook of ideas that you will be able to use to operationalize the start of your alumni program. Because when they come to a collaborative, they're bringing their own burning desires, questions, sense of curiosity to the agenda so that when we finish after day one, the agenda is built. So every collaborative will have a different look and feel based on the people that show up. And so this concept of open space technology is really empowering the group to come together with the ideas so that when we go into breakout sessions, the individuals who came to the table with the question can also be the facilitator. They don't have to be an expert in the concept, but they do have to be the one to drive the question and the curiosity around how do I launch a chapter group? How do I build a strategic plan? How do I get my leadership involved in budget? How do I get my alumni to attend events? Questions that often are usually done in isolation with one person sitting at their desk trying to figure it out now has the group consensus of 60 to 70 people, some who have done it before, that they can actually build off of. And what sets this particular model apart from what we see in our industry is that everybody is willing to share. Everyone is saying, oh, I have a strategic plan. Let me give it to you. Oh, I have a job description that we've done for an alumni. Let me give that to you. And in our field that's built around scarcity, that's a very unusual concept. And so what we try to create in open space is the ability to create trust so that people can have these honest conversations while at the same time sharing resources that they can bring back to their larger, to their programs to build off of. And then the concept of, and I think for the interest of time, I think we're going to hold on the video. There's a great video that you can actually access, and I think we'll make sure you guys get a copy of it, that really walks through the process of what open space technology means and does. There are 4 rules. The first one is when you have a small group that gets together, whoever comes to that group is the right people to be there. So don't put expectations on it. Don't feel disappointment if nobody shows up, because if no one shows up, it means that there wasn't an interest. It doesn't mean that people didn't care about your idea. It just means that at that point, it wasn't what was supposed to happen. The second is whatever happens is the only thing that could happen. So again, removing the pressure and the expectation that you're supposed to have a very active, dynamic conversation around that topic means it could work out great or it couldn't. And that's okay. Really relieving yourself of the pressure around that. Also, whenever it starts is the right time. We live in a space of feeling like we're always under time management. The goal right now is to say, if you start a little later, that's okay. If you end early, that's okay. Because when it's over, it's over. So if you finish in 15 minutes, you finish in 15 minutes. If you go over an hour, that's fine too. The goal is just not to put any parameters or expectations around the open space experience so that people can work through whatever the challenges and issues are. There is a concept that we utilize at the collaborative called the law of 2 feet, which means that if you're in a small group and you got what you needed from that group, we want you to use your 2 feet to get up and move to the next program or the next small group. So the expectation is not for you to stay somewhere that you don't feel like you're getting anything out of it, but to move to the next area where you feel like you can learn and gain some insight. And so we don't want to create a scenario where people feel locked into one thing. We want them to have agency around being able to move to the place that gives them the most value. Because again, at the end of our collaboratives and at the end of our events, we want people to have accountability and ownership of ideas that they can bring back to their treatment center to start building strong recovery communities. These are just some of the guidelines that we use for breakout sessions. So if you are to use open space technology for your workshops, again, feel free to leave the session at any time. That we usually try to regroup after to debrief and ask people if they have any questions or insights. What we've learned from this process of using open space technology is that alumni professionals become both the teacher and the learners. That they create a playbook of ideas and existing resources that they can take back to leadership, that they're building a community of national peers. So many people in the alumni position often feel very lonely because they're the only one in that position in the organization, and no one really understands the nuanced nature of this role. So a big part of what we do at TPAS is we create a national network of alumni professionals now into Canada who can work with you to help you navigate some of those hardships that you might be experiencing in the position or looking at new idea opportunities. And then the big thing that we've really found to be the most compelling about our collaboratives is that we're really eradicating this concept of competition, because in truth, the only competition should really be the disease itself. We really want to continue to move away from this idea of scarcity, and we build the concept of sufficiency through all aspects of what we do through our collaborative models, utilizing both the Peter Block questions and open space technology. And so with that, I'd like to take a couple minutes. I'm going to stop share and ask Casey a few questions about his experience working as an alumni professional for Cumberland Heights. And first kind of ask you about how has this concept of the TPAS model of collaboration and abundance shaped the way that you do your work at Cumberland?
Well, I think ultimately, I think like with any job, getting the structure down and the daily expectations and all those things were paramount. And what TPAS did was it went ahead and, without being crude, like it went ahead and made all the mistakes for me. And so having 60 or 70 other professionals that are doing the job I'm doing, who've had the experience of trying and failing, kind of put me way, way ahead. So I probably grew, I think there's a Dr. Seuss book that I wanted to quote, but I couldn't think of the exact quote, but I probably grew twice or three times as much as I would have naturally as a professional. And then once given kind of that baseline of like, okay, this is who I am, this is how we do things, these are the types of things we do, I was able to cultivate kind of a cultural freedom within the organization. And I don't think I would have ever been able to do some of the really, really, really cool stuff and innovative stuff that I did if it weren't for the TPAS backdrop to say, hey, listen, I'm doing the things that I need to do and I'm accessing the resources that make the most sense. Because like Gina made a really good point. It is an isolating job. And so it's hard to go to leadership with no other, just an idea, right? Like just like, hey, I want to spend $5,000 on this, right? Even though I have the vision, I'm talking to alumni, I know it's going to work. I've got, what I mean? I've got all these things and just trying to make something new happen without that validity. TPAS gave me validity. And as much as everything else was shape shifting, TPAS gave me like the ability to kind of conform and grow in my, because alumni services in Nashville, Tennessee are a lot different than alumni services in Denver, Colorado, or Portland, Oregon, or San Diego, California. And I could learn from all of those people in an innovative way and come here and do it exactly the way I needed to do it. And that's just one small thing. I mean, the other thing is I've grown as a leader leaps and bounds. I mean, the position that I was in when I started attending TPAS and taking advantage of membership versus the position I'm in today is an incredible contrast that probably wouldn't have happened naturally without the guidance and tutelage that took place through that membership.
Yeah, and I think we hear that often from a lot of our members. We have quite a few alumni professionals like yourself who maybe started out in a coordinator role and are now leaders in alumni positions, supervising teams of alumni coordinators. And so we are seeing some big changes happening in the field of alumni where we hadn't seen before. And knowing that now we've got leaders that are taking on new roles, some of which are maybe even pipelined for potentially being in chief operating officer positions and potentially CEO positions with some of the organizations that they work with. So while this was seen originally as an early entry position, we're now starting to see the sophistication of alumni programming because the nature of the position is so tactical, and there's so much value around what it brings to the organization, but then obviously to the individuals as well. Let me ask you about your advice that you would give to a program or professionals who are hesitant to adopt the TPAS model or who feel protective of their secret sauce. What would you say to those programs?
Well, and I'm going to go ahead and assume I'm talking to someone in operations or maybe even, like BD, because, anyone who doesn't want this is probably somebody who's pretty protective of a team of people whose job is to engage, let's call it, with a different community. And so, there's a big difference between going out and trying to engage and get more referrals through different community operations, right? And having this somewhat altruistic, broad, hard to quantify, how do you attach the data to it idea. And so I think for those people, I would sit down and I'd say, listen, like, this is how I do it, and this is how I would show you how I do it, and these are the data that are collected, and this is the influence that we have. It's not just this, it's not just this, it's not just this, it's all these things, and give them kind of more of an insight into how the membership with TPAS fosters all of those things in a broad way, because there's so much more going on in the background than it appears, and most people are just stuck in their own insight. And so I would offer new and key insights. And luckily, I'd be doing it from a position of, we're a pretty old organization. We've been doing things the way we've been doing them for a long time, and we've changed things because of TPAS. And so I could offer from that angle. And then the other side of it is, like, you don't even understand the incredible value that it offers, a community when we're out and we're doing these things, and it's not a marketing structure. It's not coming from a BD standpoint. It's just like, hey, come out, let's do this, let's be involved. I'm putting on 12 Narcan trainings this year as alumni events, right? Mm-hmm. And that's not just for our alumni, that's feeding the community, and it's given us, but the marketing value of that passively is incredible. And, depending on how you set your budget, pays for all of that, Mm-hmm. So there's a few different angles depending on what leader you're talking to.
Well, I'm going to take a moment now and talk for a second about member benefits of being a part of TPAS, because I feel like I would be remiss if I didn't mention to those listening today what it could look like for your organization to become a member. TPAS actually currently has close to 100 active treatment organizations that are members of our larger ecosystem. Again, all behavioral health related. We offer some very distinct member benefits. And as I mentioned earlier in the call, the focus is around working with our professionals who will then elevate and level up the work that they're doing within your organization. We've talked heavily today about our flagship events, which are collaboratives. We do those twice a year in person, one on the East Coast, one on the West Coast. We also offer a virtual event that's a more abbreviated version of our collaboratives, and those are usually in July, 3 or 4 hours, to give people sort of a taste of what the collaborative experience is like. We also have a new app that we launched called TPAS Community App, and that app is available now for download. You can get it on Google Play Store or Apple Store. You will see a public-facing version of that gives you some kind of nuggets of resources that your alumni professionals can use. When you become a member of TPAS, you get the full member access, which gives you access to our virtual library. These are 30 to 40 webinars recorded on demand and available for people to use that teach you from soup to nuts how to open and build an alumni program or to level up an existing alumni program. We also have white labeled templates that are available for folks to take advantage of so that they don't have to reinvent the wheel. And then we also offer live workshops every month that are very topic specific for our members that they can have access to at no cost. In fact, this month we have one that's open and free to the community. And if you visit TPAS on LinkedIn, you can actually register for that workshop. And it's on the power of technology and alumni services. So that is available. That is one of our free workshops we make available to the public. But all of our workshops are typically member benefits only. We also offer what we call group coaching once a month, and it's an opportunity for alumni professionals to gather on a monthly basis in a networking fashion to share ideas and resources. And then we also offer one-on-one coaching sessions for alumni professionals to triage specific issues that they need help with subject matter experts. We offer mastermind courses for leaders in alumni professions, so that way they can learn how to be more effective in their leadership role, because many of them have not been trained how to be a leader, but we do a lot of work specifically around helping them in that area. So we believe our benefits, our membership dues are quite reasonable for organizations, and it's based on the annual revenue of the organization. Your dues cover a half-time executive director, offset the cost of our collaboratives, our app, and virtual events, as well as our marketing materials. And then it's unlimited seats. So anybody within your organization has access to our member benefits. And so I am at 1 minute left and want to just say again, thank you so much for this opportunity to be able to share with you the power of TPAS. I would encourage you to really take some time to evaluate the concept of how we all in our industry can live in a space of sufficiency, knowing that our biggest advocate right now is to help people get access to treatment and resources, moving away from the concept of competition. And I believe TPAS is going to be the disruptor in the industry to help people see that. If you have any questions or would like to learn more, or you'd like to get connected to hear about how your organization can become involved with TPAS, I've left my information here. And finally, I want to thank Casey again for co-presenting with me today, as well as Angie and the team for giving us this opportunity to talk about TPAS.
I want to thank Gina Thorne and Casey Hyatt for presenting today. Thanks as well to you for participating. While this webinar does not provide CEs, it is eligible towards the requirement for renewing the CATM CAMs, a comprehensive program of 6 courses. The CATM is a first-of-its-kind certificate program that teaches you best practices and practical tips from renowned legal and industry experts on how to market your addiction treatment. It is completely online. We hope you join us for future NBHAP webinars. You can sign up for our various newsletters, which include emails specific to upcoming events, at our website, www.nbhap.org. With that, this concludes today's webinar. Thank you very much.